We'll shortly announce how we're going to make that decision, and there will be an open process, and I look forward to working with my honourable friend and her colleagues, and with colleagues across the NHS in Lincolnshire to make sure that they can put together the best possible application.
Jack Barrington.
Thank you, Mr. Speaker. I'd like to take this opportunity to thank the Government for investing in both mental health facilities at the Harplands Hospital and acute facilities at the Royal Stoke. Together, this will see over £32 million being invested in our local NHS. So would my right honourable friend agree it is more important than ever, as our NHS starts to recover from the pandemic, that we provide the best possible health facilities?
Joe State.
Yes, I would, Mr. Speaker. And the NHS has clearly played such a critical part in the response to the pandemic over the last just over a year. And I want to thank all those who are working in and around Stoke, including at the Royal Stoke, which is a great hospital. We have put £32 million into the local NHS, and we protected the NHS even through the worst challenges of this pandemic. And of course, I'll be open to further investment to make sure that the NHS across Stoke gets the support that it needs so that we can build back better. And today, of course, we are all able to see the improvements that are being made in the response to the COVID pandemic with the opening yesterday of Step 2. I'm delighted, Mr. Speaker, to see that you've had a haircut. So many of us have been looking forward to being able to get life back to normal. And thanks to the work of people across Stoke and across the nation, we're able to take these steps.
I think this is Mrs Hoyle's efforts, but there we are. Getting the Shadow Minister Manners.
Thank you, Mr. Speaker, and congratulations to Mrs Hoyle on a job well done. So, of course, new investment is welcome, but it is no consolation to those patients missing out because the rest of the NHS estate is being starved of investment. We've seen a 23% increase in treatments being delayed or cancelled in the last year because of infrastructure failures, and the maintenance backlog went up by another 50% last year as well. We're not going to see those record waiting lists drop if operations are cancelled because basic repairs are not done. So can the Secretary of State tell us by what date will we see no more delays to treatment because of crumbling buildings?
Well, we're putting a record amount of investment into the infrastructure of the NHS, and that's evidenced by the questions we've had already, the improvements in Stoke, the improvements in Scunthorpe and across the rest of the country. Of course, it's not just about the physical investment, it's about making sure we support staff to be able to deliver and making sure that the NHS gets the support it needs to tackle this backlog. We have got a very significant backlog because of the pandemic, and we're working incredibly hard to tackle it.
Tom Randall.
Question 4, sir.
Thank you very much, Mr. Speaker. With your permission, Mr. Speaker, I would like to answer questions 4 and 5 together. Firstly, I would just like to pay tribute to our fantastic NHS and all the frontline vaccinators, our volunteers, armed forces, local authorities and all those working on the vaccine deployment programme. I'm very grateful for their tireless efforts in vaccinating those most at risk across the country. I am absolutely delighted, Mr. Speaker, and no haircut puns at all here, that another significant milestone has been reached as we have met our target of offering a vaccine to those in cohorts 1 to 9 ahead of schedule. Over 32 million people have had their first dose and more than 7.6 million have had their second dose. We are making phenomenal progress, but we continue to remain focused on ensuring no one gets left behind.
Mr. Speaker, well, last week I became one of those people who had their first jab at Boots the Chemist in Nottingham, and will my honourable friend join me in thanking all those, not only places like Boots, but all those involved in the rollout of the vaccine of the Pfizer-BioNTech, Oxford AstraZeneca and the Moderna vaccines? And will he agree with me that the best way out of this situation is to get that jab, and so when the time comes and people get that call, they should take that opportunity as soon as they can?
I'm grateful to my honourable friend. I would absolutely agree with him. Thank Boots the Chemist in their frontline capability, but also in their distribution arm as well, which has helped us distribute both Pfizer-BioNTech and AstraZeneca and now Moderna. And I absolutely agree with my honourable friend that when you get the call, please come forward and have your jab.
Let's go to Elliot Colburn. Elliot.
Thank you, Mr. Speaker, and I welcome today's news that the over 45s are being invited to receive their first dose of the vaccine, and I thank everyone in Carshalton and Wallington involved in the rollout. I recently held a vaccine roundtable with NHS leaders in Carshalton and Wallington to encourage everyone, including ethnic minority groups, to come forward and get the vaccine when their time comes. So could my right honourable friend update the House on what steps the government is taking to work with community leaders and others to ensure that every part of our community comes forward and gets the vaccine?
I'm grateful to my honourable friend. I would echo the comments that he makes about the incredible work happening across the London Borough of Sutton, and to thank him for his work in promoting the vaccine. According to the latest NHS figures, almost 90,000 individuals have had their first dose of COVID-19 vaccine in Sutton. To this end, we are working closely with faith and community leaders to help spread information about vaccines through trusted, familiar voices and in a range of different languages and settings. This also means leveraging the influence of celebrity figures such as Sir Lenny Henry. It's a very powerful and incredibly moving call to action letter and video to Black and Afro-Caribbean communities. Really important. We're also working to support the vaccine programme over important religious observances. For example, Ramadan, which begins today. We are working with the Muslim community, Mr. Speaker, reiterating the verdict of Islamic scholars and key Muslim figures within the NHS that the vaccine does not break the fast and is permissible. So come and get your vaccine.
Substantive question to Minister Dorries.
Thank you, Mr. Speaker. In October 2020, I commissioned the Care Quality Commission to review how do not attempt cardiopulmonary resuscitation decisions were taken throughout the COVID-19 pandemic and whether they had been inappropriately applied. We welcomed the report, which was part of the CQC, which was published on the 18th of March, and we are committed to driving forward delivery of the recommendations through a ministerial oversight group, which I will myself chair, to ultimately ensure that everyone experiences the compassionate care that they deserve.
Let's go to Karen Smith. Karen.
I welcome the Minister's comments. It's over a decade since I worked with clinicians on how to communicate end-of-life care, so I was really shocked about some of those reports and reading the CQC and Compassion in Dying reports. The lessons learned from coronavirus can and should be seen as a catalyst to have more open and honest conversations about CPR decision-making and advanced care planning. But will the Minister commit to a public awareness campaign, including groups such as Compassion in Dying, Marie Curie, Hospice UK, to ensure that patients are fully aware and at the heart of these decisions?
I thank my honourable lady for her question, because that is exactly what we're trying to do at the moment. We have posted a public-facing message on nhs.uk website, which informs the public of how DNA CPR decisions should be taken and the process for that. There should be no blanket applications of DNA CPR notices. Every patient should be involved in the decision when a notice is applied, including their family and relatives and care workers, and where possible signed by a clinician. So that engagement with the NHS and the wider public and the NHS, voluntary sector and care sector is ongoing, and we continue to monitor this.
Number 7, Mr. Speaker.
Thank you, Mr. Speaker. We want health and social care to be effectively joined up with the different parts of our system working together to meet people's needs. The Health and Care White Paper sets out our plans for integrated care systems, which will not only join up local NHS organisations, but also strengthen collaboration between the health service, local authorities and others involved in social care.
Thank you, Mr. Speaker. One of the things that will really help the integration of health and social care is better use of technology and innovation. But one of the barriers we face is the sharing of information between different clinicians, GPs, hospitals, social care settings. So could my honourable friend confirm that as part of the plans for better integration, we're looking at how data and information can be shared much more effectively?
Thank you. My honourable friend is absolutely right. Interoperability is essential to harness the potential benefits of health and care data for individuals and to create a health and care system that is fit for the future. We're going to legislate to ensure more effective data sharing across the health and care system. We'll be outlining our plans in the upcoming data strategy for health and social care.
Let's go to SNP spokesperson Martin Day, the first of 2 questions. Martin.
Thank you, Mr. Speaker. Despite the incredible challenges of the last year, neither the government's white paper nor the budget even mentions social care. Health and care integration has been progressing in Scotland since 2014, and the Scottish Government has committed to develop a national care service and ensure equity across Scotland. Will the Minister make such a commitment for England?
Well, actually, I would have to disagree with the honourable member that the white paper does indeed mention social care and does include several steps on the path for reform for social care, and we are also going to be bringing forward further information about social care reforms later this year.
Let's go back to Martin Day. Martin.
Thank you. Integration and service improvement cannot be delivered without sufficient social care staff. The Scottish Government already funds the real living wage for social care staff in Scotland, included them in the £500 thank you bonus, and plan to standardise pay and training. Does the Minister not recognise that the only way to attract people to make a career in social care is by valuing care staff?
Well, on this, actually, I agree with him that it is essential that we value social care staff. And just as we've valued the NHS staff during the pandemic, so we have rightly recognised the vital contribution of the social care workforce. We must continue to value our social care workforce, and we plan to bring forward proposals for the social care workforce as part of our social care reforms.
So can I ask a question to Minister Wren?
Thank you very much, Mr. Speaker. The Government is committed to putting patients at the centre of our health service. Patients are consulted on their local health services in a wide variety of contexts, including through Healthwatch England, the independent national champion for patients. And where a major or substantial reconfiguration or change to services is proposed, the local CCG is legally required to hold a consultation with local people.
Steve McCabe. Steve.
Mr. Speaker, I wrote to the Health Secretary about this a month ago. Last December, amid the pandemic, Birmingham and Solihull Clinical Commissioning Group decided to close Goodrest Croft GP surgery in my constituency with over 6,000 patients. They didn't consult anyone because apparently they're not required to. Does the Minister find this acceptable?
Thank you very much, Mr. Speaker. Well, I'm grateful to the honourable gentleman, and while not familiar with the detail of the specific case he raises, I'm very happy to meet with him to discuss that local case if that's helpful to him.
Substantive question to Minister Churchill.
Thank you very much, Mr. Speaker. The National Cancer Registration Analysis Service works closely with hospital trusts to determine sources of data which can be used to complete the cancer outcomes and services dataset. Also works with software suppliers of cancer management systems to ensure that data items are able to be recorded. The compliance with data standards is monitored by local CCGs, but I recognise this isn't enough, as data is incomplete after some 8 years.
Let's go to Rosie Cooper. Rosie.
Thank you, Mr. Speaker. Currently, women with metastatic breast cancer are only counted when they die. That is despite, since 2013, it being mandatory for trusts to collect that data, as such as the number of women involved, how long they survive, and whether there are any health inequalities. Sorry, Mr. Speaker. It cannot be acceptable. It cannot be acceptable to count only the dead, not the living. So will the Minister commit to ensuring that the 2013 mandatory requirement to collect data on women with metastatic breast cancer be enforced?
Thank you, Mr. Speaker. Yes, because I think it's, as I explained in my former answer, I think one of the challenges is there isn't a consistent way of capturing the data. We need to sort that out. We need to make it simple. We need to make people understand what the data is that we are collecting, and then we need to make sure that both for breast cancer patients but all metastatic cancer patients, we know where they are and that we're helping them as effectively as they can with this disease.
Question number 12, Mr. Speaker.
The Government recognises that the effects of COVID-19 have increased the demand for bereavement services and the complexity of grief these services support. In response to this, since March 2020, we have given over £10.2 million to support mental health charities, including bereavement services, to support adults and children struggling with mental well-being due to the impact of COVID-19.
Mr. Speaker, last year, along with the Cooperative Party, I called for a proper plan for bereavement to ensure that everyone who has experienced loss during this difficult period has the support that they need. Awareness of services available is vital for people to get this help. And the Good Grief Trust, with whom I've been in contact, have said that too many people simply don't know where to turn. So could the Minister tell me what steps she is taking to help signpost families to bereavement charities and support and increase awareness of the support available to families in need, also including support that can be signposted from hospitals when loved ones die?
I thank my honourable friend for what is a very important question. And the Mental Health Recovery Action Plan, published on the 27th of March this year, aims to respond to the impact of the pandemic on the mental health of public, specifically targeting groups which have been most impacted. She mentioned the Good Grief Trust, and I mentioned the £10.2 million of funding that we've allocated recently. This is on top of the £2.3 billion a year for general mental health, which includes bereavement and counselling, and also the £500 million additional spending that we received in the SR review. Some of that money did go to the Good Grief Trust, and they've done a fantastic job. And they've been signposting by putting cards in doctors' surgeries, A&E departments, in hospitals, so people have immediate access to a line. But there are 700 charities like the Good Grief Trust across the UK who are providing bereavement and grief counselling services to many members of the public. We recognise that the demand is higher, but the services are there and available.
We now come to Shadow Minister Dr Hancock.
Thank you, Mr. Speaker. With your permission, Mr. Speaker, I would like to pay a tribute to my father, Mohammed Aslam Khan, who passed away a few days ago. Not only was he a keen cricketer and an amazing dancer, he was a champion for equality. He was incredibly strong and brave until his very last breath, and he shall be missed beyond measure. I'd like to extend a huge thank you to all the team at St George's, especially the marvellous team on Dalby Ward. Also to Victor and the incredible staff and carers at Ronald Gibson House, and to a wonderful nurse called Anne Wheeler. My brother and I saw firsthand, Mr. Speaker, that not all angels have wings. Mr. Speaker, COVID-19 has stripped the humanity out of grieving, with millions being unable to attend funerals, say final goodbyes, or be with loved ones following a death. Last year, the government provided £10.2 million to mental health organisations to ensure services could continue during the pandemic. Many people have been relying on the support of dedicated bereavement organisations to help them cope, yet the extra financial support ended on April the 1st. Will the Minister please consider reviewing this vital funding immediately to ensure no one has to go through bereavement alone? Thank you.
Minister.
Thank you, Mr. Speaker. I pay tribute to my honourable friend and her brave words about her much-missed father. Politics divides us, but grief across this House on all sides, for many reasons, unites us. And I have personally declared to my honourable friend that I'm here should she need me. And I pay tribute to her bravery for being here today so soon after the loss of her wonderful father. And I hear her request, and it's constantly under review. Bereavement services are incredibly important to me personally, but to many of us. And the £10.2 million which she mentioned, there are 700 bereavement charities, of which the Good Grief Trust is one. We monitor carefully how people access bereavement services. We know there is an increased need at the moment, and that is being watched very carefully. But she is incredibly brave. Thank you.
Substantive question to Minister Churchill.
Thank you, Mr. Speaker. We're continuing to work with the NHS and the wider scientific community to better understand the long-lasting effects of COVID-19 infection, as well as potential treatments, and we're committed to supporting patients who are suffering from long COVID. Specialist NHS assessment services have opened across England, and the Your COVID Recovery website contains support and provides a personalised programme for people recovering from COVID-19 following a clinical consultation. Over £30 million worth of funding has already been committed to research projects, and a further £20 million was made available on the 25th of March.
Let's go to Paul Holmes. Paul.
Thank you, Mr. Speaker. And can I pay tribute to all NHS and military staff for administering vaccines across the UK, including to my mum and dad last week? The Minister knows of the debilitating and lasting effects of long COVID. So can I ask if she will outline the funding elements that she proposes to put forward, which she's just done, and whether she may set up a specific task force to look at more research into the damage that this long COVID causes to people and the effects that it has on so many people? Thank you.
Minister.
So, I thank the honourable gentleman for his question. We are already taking strong action in this area, and we have already worked hard taking long COVID seriously. We're listening to patients, having a patient-first approach, working with the NHS, the wider scientific community, engaging with the Royal College of GPs to better understand the disease, which is physiological, neurological. It is different for different people, and therefore treatments need to be different for different people. So making sure that we have the best post-COVID COVID assessment care and the best pathways is what we are working on.
15 withdrawn, so go to Andrew Bowen.
Number 16, sir.
Thank you very much, Mr. Speaker. The COVID-19 vaccination programme has been the biggest in the history of the United Kingdom. The UK government has ensured that the excellent work done in procuring vaccines by the Vaccines Task Force for the whole country was rolled out to protect people across the UK. And to support the rollout in Scotland, I recently announced an additional £660 million of UK government funding for Scotland, on top, of course, of the £3.6 billion that Scotland's already receiving over the next financial year through the Barnett formula.
Andrew Bowen.
I thank my right honourable friend for his answer. Does he agree with me that this is proof of the irrefutable truth that we achieve much more together than we ever could apart, and that this, the vaccination rollout and recovery, is what we should be focusing on, not a damaging and divisive second referendum on Scottish independence, which would be the case if the Scottish National Party won the Scottish election on the 6th of May.
Mr. Speaker, I entirely agree that the vaccination programme has clearly been a huge UK success story. And it's because of the UK working together, the NHS across the whole UK, the military working in support across the UK, the UK government, and of course working with the devolved authorities and with local councils. It's a big team effort. And to split and separate out this team effort for no good reason would be, in my view, counterproductive to improving the lives of people across this whole country. We should be working together, not pursuing separation.
Right, we have a substantive question to Minister Churchill.
Thank you, Mr. Speaker. We've made it clear our intention to end the advertising of high-fat salt and sugar products on television before 9 p.m. We recently held a short consultation on how to introduce advertising restrictions for online, and we'll publish our response soon. A level playing field, however, is important. I want to make it easy for everyone to be healthy.
Could we, can I just say, are they grouped as well, Minister?
I apologise, Mr. Speaker. They're grouped with number 18.
Let's go to Andrew Selou. Andrew.
Does the Minister agree that ending junk food marketing online is hardly an outrageous assault on our freedoms, would remove 12.5 billion calories a year from children's diets, and allow advertisers and food companies to make plenty of money from producing and marketing healthy food?
Minister.
I thank the honourable gentleman for his question. Indeed, I do. We are not banning food. It is very important that we make the environment right to ensure that people can make the healthy choice as the default option and enjoy a healthy, balanced diet, which they have the full knowledge and understanding of what it is that they're purchasing. Actually, I see this as a great opportunity for companies.
Let's go to Craig Whittaker. Craig.
Speaker, and my deepest condolences, thoughts and prayers to the member for tooting in her whole family. But Mr. Speaker, it's good to hear that the Minister says that there will be a level playing field in this area. But it has been reported on national media over the last few weeks that the government seemed to be dropping plans banning ads online for foods high in fat, sugar and salt. So on that basis, surely the Minister will agree with me when half of 10-year-olds and 83% of 12 to 15-year-olds own a smartphone, with 86% of those children using video on demand, then it would be an absolute nonsense to ban advertising on mainstream broadcast TV, where children watch very little TV.
Minister.
I thank my honourable friend for his question. I agree that actually making sure a level playing field is there is the right thing to do, and if currently we were doing so well, we wouldn't have the number of young people, children and young people, overweight or living with obesity. So making sure that we do everything we can so that every child can be a healthy weight is something we must work on. But he will not get me to preempt the consultation, which we will be reporting on shortly.
John Trickett.
Number 19, sir.
Thank you, Mr. Speaker. We recognise the extraordinary commitment and compassion of social care staff, especially during the pandemic. Whilst the government does not have direct responsibility for pay in adult social care in England, we want to see care providers reward and support their staff appropriately for the vital work they do. During the pandemic, we've asked care providers to pay staff full pay when they need to self-isolate and provided over £1.4 billion of extra funding to support the cost of this and other infection control measures.
John Trickett.
Thank you, sir. Well, first of all, I imagine the whole House will join with me in mourning the 364 care workers who've died in public service since COVID began. And many of them have told me they feel undervalued by the fact that their average salary is only £17,200. I'm sure there are very few ministers who could live on that kind of salary. And they particularly feel devalued when they discover that the government are paying 9 times that salary equivalent to test and trace consultants. It is an outrage. And so will the Minister now say how she will show that these people are valued by doing 3 things? First of all, end privatisation. Secondly, insist on a proper salary rise. And thirdly, ensure a professional career structure is instituted which recognises and rewards the professionalism, talent and commitment of these essential workers.
Minister.
Thank you, Mr. Speaker. Well, I share his sorrow for the lives that have been lost amongst the health and social care workforce during the pandemic. I'm determined that we will support and continue to support our health and social care workforce through these difficult times. One of the things that I want to achieve for our social care workforce, whom I'm truly ambitious, is that rather than doing something one-off for the pandemic, we should come up with a workforce strategy which will improve the opportunities for those working in social care to have a greater opportunity to develop their careers and real career progression working in that sector. And that will be part of our social care reform proposals.
Shadow Minister.
Thank you, Mr. Speaker. Despite repeated promises, the truth is you'd be better off stacking shelves at Morrison's than caring for older or disabled people, and that is simply not good enough for our country. Can the Minister confirm that the government's COVID infection control fund had to be used to improve pay so staff didn't have to work for more than one care home and could actually afford to self-isolate? And if that's the case, will she commit to permanently enshrining these improvements across the sector to keep all care users and all care workers safe?
Minister.
Well, in response to her question about the use of the Infection Control Fund, it was available to providers to use in a range of ways to keep their residents safe from COVID, including, for instance, reducing the movement of staff between one care home and another, which is part of the way that care is often provided as part of the service model. And also, as I mentioned in my earlier answer, to fund full sick pay for staff who would need to self-isolate because of COVID. But as I will say, I'm determined that as part of our social care reforms that we will be bringing forward, we will be looking at how best we can support the workforce.
Christian Wake.
Question 21, Mr. Speaker.
Minister.
A written ministerial statement was published on the 11th of January 2021, updating Parliament on the Government's current progress on each of the 9 recommendations. The Government will respond in full to the report later this year, and it took over 2 years to produce the report, and we therefore consider it vitally important for the sake of patients, and especially those who have suffered greatly, that we give this independent report the full consideration it deserves.
Christian Wake.
Thank you, Mr. Speaker. Baroness Cumberledge's respected report makes it clear that those harmed by sodium valproate have suffered great and irreparable harm for many decades, and this redress is that redress is needed. The patient reference group adds more delay to a group which is waiting long enough already. So will my honourable friend commit to doing the right thing today and take up this issue of redress and give those harmed the support that they have waited so long for?
Minister.
I would like to first convey my most sincere sympathies to anyone who has suffered as a consequence of taking sodium valproate during pregnancy. It does remain still the only drug that some women who suffer from epilepsy can take to control their epilepsy. And as set out in the recent written ministerial statement, the Government will still carefully consider the recommendations, and it will make a full response to the whole report later this year.
Substantive question to Minister Waitley.
NHS nurses have gone above and beyond throughout the pandemic. We're committed to increasing the number of nurses in the NHS by 50,000 over this Parliament through improving retention, increasing domestic supply and international recruitment, and we are on track to do this. The number of nurses in the NHS is at an all-time high, with 301,491 full-time equivalent nurses employed in NHS trusts and CCGs.
Let's go to Claire Coutinho. Claire.
Thank you, Mr. Speaker. We all know how hard our NHS nurses have had to work in the past year, many without a break, and for those with international origins, without seeing their families either. As public focus inevitably turns towards the NHS backlog, can ministers assure me that they will work with NHS England to protect staff holidays and enable and encourage NHS staff to get the rest and recuperation that they need?
Minister.
Thank you, Mr. Speaker. I completely agree with my honourable friend that staff must be allowed and supported to recover from the pandemic. We've advised NHS employers to make sure staff can carry over annual leave, and we're determined that the pace of NHS recovery must also allow staff the rest and recuperation they need.
Substantive question to the Secretary of State.
Mr. Speaker, the UK is one of the best places in the world to locate a life science business. We're making vaccines in Livingston, in Wrexham, in Oxford, and in Hartlepool. We're making cell and gene therapies in Stevenage, surgical robots in Cambridge, cancer medicines in Macclesfield, hip replacements in Leeds, and care products in Hull. And last week, we announced another £20 million fund to incentivise companies to put medicines and diagnostics manufacturing investments here in the UK.
Let's go to Ian Lavery. Ian.
Thanks, Mr. Speaker. Some people have got very short memories, I must say. The UK was found desperately wanting when this horrid COVID-19 pandemic swept through the cities and towns and villages of this country. The nation's silverware was sold off and the stock cupboards laid empty and bare. There was a deliberate policy of underinvestment in the NHS with a view of buying everything on the cheap from elsewhere. This was an ideological crime, Mr. Speaker. What steps are the government taking to ensure that we are never again left without the capacity to produce essential health and safety equipment And how might a real industrial strategy aid the need to produce PPE to bring good, well-paid jobs to long-held back communities like Wandsbek here in the northeast?
Secretary of State.
Well, Mr. Speaker, we might have a meeting of minds between the honourable gentleman and me. We've, over the last year, developed the capacity to produce 70% of the country's PPE needs here in the UK. And that was a target that we set last summer. We met it at Christmas for all different types of PPE with the exception of gloves, but we keep working on bringing glove manufacturing onshore as well. And as I said in my opening response, we've built a huge amount of pharmaceutical manufacturing capacity here in the UK, and there's a lot more to come.
Ruth Capri.
Question 24, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. It's essential that we increase the amount of research to treat brain tumours, which is why in 2018, through the NIHR, the government announced 40 million over 5 years for brain tumour research as part of the Tessa brain cancer mission to increase the number of applications and grants allocated. The NIHR released a highlight notice that encourages collaborative applications to build on recent initiatives and investment already made in this area, as well as working with the Tessa brain cancer mission to fund workshops for previously unsuccessful researchers in order to support them in submitting higher quality applications.
Ruth Capri.
Thank you, Mr. Speaker. Like many across the country, my constituent Greg has a family member with a brain tumour, in his case his young nephew. The 40 million is certainly welcome, but if it was being spent, and in fact only 6 million of that funding has been delivered, and there are still difficulties for those trying to get grants for this very urgently needed research. So could the Minister commit to taking a more proactive approach to this, such as ensuring that brain tumour experts actually sit on the grant panels for research bids?
Minister.
So I'd like to thank the Honourable Lady, and I'd also like to extend my good wishes to Greg for his treatment. There's actually been 8.8 million committed so far based on the NIHR programme and academy spend. I think the important thing here is the quality of those applications to make sure brain tumours are invidious, and we need to do more and we need to go faster. I will look at her suggestion, but I am aware of the fact there are already experts sitting on the panel.
We now come to Jonathan Gillis.
Thank you, Mr. Speaker. Helping people to achieve and maintain a healthy weight is one of the most important things that we can do to improve our nation's health. That's why last summer we published our Healthy Weight Strategy. We are taking forward actions from previous chapters of the Childhood Obesity Plan, as well as further measures to get the nation fit and healthy and protect against COVID-19 and protect the NHS. This question is grouped with 26, Mr. Speaker.
Yes, but unfortunately we've not got Jonathan Gillis. So you managed to jump in before he could speak. Not to worry, so we'll go to James Daly.
Thank you very much, Mr. Speaker. Encouraging an active lifestyle is a crucial part of tackling the obesity challenge our country faces. Therefore, does my right honourable friend agree that local authorities working with partner agencies should invest in iconic community venues such as Gig Lane within my constituency to house a wide range of public health services and provide inspirational settings for young people to take part in sport, no matter their background or personal circumstances?
Minister.
I thank my honourable friend for his question, and I agree wholeheartedly that we should encourage all children to make sure that they have access and can take part in both sports but also enjoy the outdoors. Regular physical exercise is important for health and well-being of young people, but also how the local community has an important role to play in developing facilities. It's why the government launched a 150 million community ownership fund to ensure that across the UK, locally, we can benefit from facilities and amenities that are most important to them. It includes community-owned sports clubs, sporting and leisure facilities, which are at risk of being lost without community intervention. And I urge my honourable friend to work with his community to ensure that he has those facilities locally.
Jim Shannon.
Question number 27, Mr. Speaker.
Minister.
Cancer diagnosis and treatment is a priority for this government. I'm working with my honourable friend, the Minister for Prevention and Public Health, to make sure we have the workforce needed to deliver improved cancer care. Overall, we're increasing the number of nurses in the NHS, with over 10,000 more nurses in the NHS this January compared to this time last year. And specifically for cancer, we are training 250 more cancer nurses and 100 more specialist chemotherapy nurses.
But Jim Shannon.
Thank the Minister for that response, very encouraging. But can I ask the Minister if she would outline what steps have been taken to ensure that Northern Ireland students who educate on the UK mainland nursing schemes can easily transition to fill the needs in our cancer wards, both here in the UK mainland but also in Northern Ireland?
Well, I thank the honourable member for his question. If he will allow me, I will look into that and I will write back to him to let him know.
And the Minister Alex Norris.
Thank you, Mr. Speaker. Prior to the pandemic, cancer services were understaffed and not meeting their targets. During the pandemic, our staff have made incredible efforts, but a cancer backlog has built up, and the government are now asking this same understaffed cohort to run their normal services and to deal with the backlog at the same time. This is unfair, this will lead to burnout, and this will not work. Will the government commit today to extra resources specifically targeted at cancer to give these staff a fighting chance?
Minister.
Well, I thank the honourable member for his question. The government has already committed significant additional resources to support the NHS with the recovery from the impact of the pandemic, and that will include recovery for cancer services as well as other areas of treatment.
We now come to Topical Secretary of State.
Thank you very much, Mr. Speaker. I'm delighted to be able to tell the House that across the UK we've met our target to offer a vaccine to everyone in the top 9 priority groups ahead of the deadline on the 15th of April. We've now delivered a first dose to over 32 million people and are on track to offer a vaccine to all adults by the end of July. This weekend, we also saw a record number of second doses, Mr. Speaker. So overall, as of midnight last night, we have now delivered more than 40 million doses of vaccines right across the UK. It's a remarkable achievement. Today, the JCVI has published its final advice on an age-based prioritisation, which we accept in full. So I can announce formally that from today, we have opened up invitations to get a vaccine to all aged over 45, and then we will proceed to everyone aged over 40 in line with supplies. Finally, Mr. Speaker, following a successful start last week in Wales, the Moderna vaccine will be rolled out in England from today. I'm very grateful to everybody involved in this vaccination programme, which allows us to lift restrictions across the country and already has saved over 10,000 lives, with more to come.
Let's go to Mr. Vyandra Sharma. Vyandra.
Thank you, Mr. Speaker. May I, with your permission, wish all those Sikhs, Hindus, Muslims, and other communities celebrating their religious and cultural events in the coming days and weeks. May all have happy, peaceful, and prosperous time. Mr. Speaker, the Secretary of State clear about the importance of vaccination, but how is his department working to ensure that all adults, maybe those without English language knowledge, maybe those with very low levels of health literacy, people in pockets traditionally untouched by health campaigns, choose to be vaccinated rather than being coerced into it, not just for COVID-19, but for other vaccines too.
Yes, Mr. Speaker, I wholeheartedly agree with the honourable gentleman. And I'm very proud of how across this House people have united to support the vaccination effort and to get those messages out there, just as he says so clearly. And it's very important that we have people working in and with communities who are trusted confidants to be able to explain the benefits of vaccination to those who may be hesitant. For instance, in Leicester, we have made sure that within, for example, the Somali community, we have Somali clinicians who are administering the vaccine and putting a vaccination centre that is staffed by the Somali community themselves near where they live, even though there's another vaccination centre around the corner, has proved successful in driving up vaccination rates in that community. I pick on that as one excellent example of the national and local system working together, listening to the data and working with local communities, and I very much look forward to working with the honourable gentleman to make that happen.
Let's go to the chair of the Select Committee, Jeremy Hunt. Jeremy.
Thank you, Mr. Speaker. At the Liaison Committee 3 weeks ago, the Prime Minister confirmed that there would be a 10-year plan for the social care sector, just as the NHS has to fix the crisis in social care. Could the Health Secretary tell the House what he thinks that 10-year plan needs to contain, whether external organisations like Age UK, the Alzheimer's Society, Care England, the Select Committee indeed, will be able to contribute to the government's thinking on that plan, and whether we'll be able to do so before the plan is published later on this year?
Thank you very much, Mr. Speaker. Well, I welcome very warmly my right honourable friend's support for and enthusiasm for this project, which the Prime Minister set out at a high level at the Liaison Committee. We're working very hard, including with stakeholders. My honourable friend, the Minister for Care, has held a number of round tables on this subject, and of course we want this to be an open and broad programme to make sure that we can get the right answers to these long-standing questions.
Now come to Shadow Secretary of State Jonathan Ashworth.
And grateful, Mr. Speaker. Can the Secretary of State explain why, following a private drink he had with Lex Greensill and David Cameron, that Greensill was handed an NHS payroll financing contract which sought to convert income from NHS staff pay packets into bonds to sell internationally to effectively make money on the back of NHS staff in a pandemic? Why was that contract given without tender? Why was that meeting he had not declared? And what pressure did he put on officials to hand this contract to Greensill?
Thank you very much, Mr. Speaker. Ministers were not involved in the decision by NHS Shared Business Services to facilitate the provision of salary advances in pilot schemes. Absolutely, I attended a social meeting organised by the former Prime Minister. And given that departmental business came up, I reported to officials in the normal way.
It's a wider pattern of behaviour, isn't it? We see PPE contracts go to Tory donors. We see a pub landlord WhatsApping him, and then the landlord gets a testing contract. We see an US insurance firm taking over GP contracts, and one of their bosses gets a job in Downing Street. It is cronyism, and it stinks. So if he thinks he has done nothing wrong and has nothing to hide, will he publish all the minutes, all the emails, all the correspondence, all the directions that he gave to civil servants, and all his text messages with David Cameron, so we can see exactly what went on with the awarding of this contract?
Well, the government yesterday announced that there will be a review into this, and that I will, of course, participate in full in the review. What I would say is that it is very important that governments engage with external stakeholders, with businesses. In fact, just as the previous question asked, it is very important that that happens in the appropriate way within the rules, which is what happened in this case.
James Davis.
Thank you, Mr. Speaker. The COVID-19 vaccine rollout has shown the value of comparable statistics, not only within this country, but worldwide. However, very often directly comparable data is lacking for healthcare performance and outcomes between England, Wales, Scotland and Northern Ireland. Does my right honourable friend agree with me that UK-wide data in the NHS, along with aligned inspection mechanisms and audit procedures, would increase transparency and ultimately improve service delivery?
Yes, I do think that we have seen through the pandemic an improvement in the ability to see what's happening right across the UK, in the NHS right across the UK, and this helps us all work together better to deliver for patients. And the one example of this is the vaccines programme, where there is, it's a UK-wide programme with UK-wide metrics, of course delivered with the local NHS wherever you are in the UK, and there's lessons that we can learn from that.
Sarah Aldy.
Thank you, Mr. Speaker. I'm hearing increasingly
difficult stories from across my constituency, from constituents whose children are suffering severe mental health problems and are regularly having to wait up to a year for a first appointment, and in that year their condition gets progressively worse, so that by the time that their appointment comes round, they're already needing much greater level of treatment than they would have needed had they been seen earlier, and also the disruptive impact that that's having on their education, on top of the disruption that they've all experienced over this last year. And the situation is getting worse, and we're seeing more and more young people needing mental health care in my constituency. What is the Secretary of State doing to increase resources in this very, very important area of child and adolescent mental health?
Yes, Mr. Speaker, we're putting record resources in, and of the increase in the NHS budget, the fastest increase in the long-term plan settlement is for mental health services, and within that for children's mental health services. Through the pandemic, we've increased support also, and there's an awful lot that we continue to need to do, and a very significant plan as part of the long-term plan for improving access to these vital services.
John Long.
Thank you, Mr. Speaker. Last week we had the fantastic news that the Moderna vaccines had arrived in the United Kingdom. Can the Minister tell the House how many vaccine doses across all 3 vaccines currently being rolled out have been allocated to Scotland so far?
Well, Scotland gets her fair share of vaccines allocated, and then we publish the amount of vaccines that are delivered. That is slightly lower in Scotland as a proportion of the population compared to the UK as a whole, but we're working very closely with the NHS across Scotland, with the armed services, and of course with the Scottish Government to try to make sure that they can catch up.
Thank you very much, Mr. Speaker. Yesterday, many hospitality venues remained closed. Those who could open erected large marquees and were able to recover some of the losses that they have suffered. Others were completely dismayed, as it is very clear that there is no difference at all between some of these marquees and well-ventilated, COVID-secure indoor hospitality. So can the Secretary of State explain what he perceives the difference to be?
Yes, the definition of outdoors used in these regulations is the one set out by the Labour government in the ban on indoor smoking.
Bell.
Thank you, Mr. Speaker. Mr. Speaker, the foul gases and odour coming from Wally's Quarry landfill in my constituency are no longer just an environmental catastrophe, but also a major public health concern. The local GP surgery in Silverdale is reporting exacerbations of asthma, hay fever-like symptoms, nausea, insomnia and depression. And the Environment Agency figures that have been passed to Public Health England show that World Health Organization guidelines for hydrogen sulfide have been exceeded on the 24-hour public health limits. It is not fair on my constituents what's going on. So what assessment has the Secretary of State made of the public health implications, both physical and mental, of the major environmental incident going on in my constituency? And will he meet with me and the Environment Secretary to discuss the matter?
I'm very happy to meet with my honourable friend. I'm very grateful for him raising this vital question of local public health in the House of Commons, and I'm absolutely determined that the authorities, both the local authority with its responsibilities and also the national authorities, including Public Health England, play their role in tackling this problem.
Let's go to Lillian Greenwood. Lillian.
Thank you, Mr. Speaker. Nottingham University Hospitals Trust is giving all its staff an extra day's leave this year to thank them for their sacrifices during the pandemic. I'm sure that's a welcome gesture, but staff here and across England deserve so much more. Real terms pay in the NHS is already below 2010 levels, and we went into the pandemic facing serious staff shortages, 40,000 nurses and 7,000 doctor vacancies. What will this government's proposed real terms pay cut do to vacancy rates?
Well, I'm very glad to say that the numbers that she uses are out of date, and we've seen a very significant increase in the number of nurses and other staff in the NHS. In fact, Mr. Speaker, we have a record number of nurses in the NHS. We have more than 300,000 nurses in the NHS for the very first time. We've seen more than 10,000 more nurses over the last year alone. And of course, the mission to work caring for others And looking after the health of the nation in the NHS has never been more important, and I'm delighted so many people are rising to that because we've got record numbers in training too.
We now come to the final question from Andrew Slew. Andrew.
Thank you, Mr. Speaker. While the NHS acted heroically when the pandemic first hit, what lessons have been learned about translating the learning of junior doctors and experienced nurses into policy more quickly? For example, junior doctors knew that loss of taste and smell was a symptom and that proning helped patients quite some time before these became policy.
Yes, there's a huge amount that we can learn from the early response to the pandemic, and it is very, very important that we adopt the scientific understanding and learnings as quickly as is rigorously possible. You need the time for the rigour, but you need to adopt the policies. We have seen in the vaccine rollout a huge amount of these lessons adopted, and the speed at which the scientific advice takes into account what we're learning on the ground in the vaccine rollout is impressive. So we should keep going down this route, always open-minded, always asking the scientific questions, and then always asking how quickly we rigorously can put those understandings into practice.
I'm now suspending the House for 3 minutes to enable the necessary arrangements for the next business to be made. Order. Order. I regret to have to report to the House the death of the Right Honourable Cheryl Gillan, the member for Chesham and Amersham. I know honourable members in all parts of the House, including the deputies, like myself, are in shock and were great friends of the said member. I know that the House will join me in mourning the loss of a colleague and extending our sympathy to the Right Honourable member's family and friends. Cheryl was a member of this House for nearly 30 years, and in that time she made an outstanding contribution from both backbenches and front benches. And as the first woman to be appointed as the Secretary of State for Wales, she was a doughty defender of her constituents' interest, most notably in her long campaign against HS2 rail line, and was the champion of the Private Members Bill, which led to the Autism Act of 2009. Above all, she will be remembered as a friend and a mentor to many members, especially new members on all sides of this House. I also take this opportunity to pay tribute to 5 former members who passed away while the House was in recess: Peter Ainsworth, Ian Gibson, Robert Howarth, Paul Marland and Baroness Williams of Crosby. Our thoughts are with their families. Order. I will now take some brief points of order to allow for some tributes to our esteemed colleague. Point of order, Geoffrey Clifton-Brown.
Thank you, Mr. Deputy Speaker, and I know the family will appreciate those words that you've just said. As the House knows, Cheryl passed away on the 4th of April, courageously fighting against the odds with cheerfulness and bravery. Cheryl, the Deputy Speaker, and I came into the House together 29 years ago and became firm friends. I attended her beloved husband Jack's funeral in 1919, and I was constantly in touch with her throughout her illness. So it is with enormous sadness that I am privileged to pay tribute to such a special person. After several jobs in the Conservative opposition years, she was appointed Secretary of State for Wales and was much respected for singing the Welsh national anthem in the Welsh language. After leaving the Cabinet, as you said, Mr. Speaker, she stepped up her opposition to HS2. There was not a debate or a question that took place in this House on the matter where Cheryl did not speak. After the House changed the rules on the 19th of January this year, Cheryl was able to make her final speech, fittingly on consideration of Lord's amendments to the high-speed rail West Midlands to Crewe bill. And despite her advancing illness, she was in her usual feisty form, denigrating the whole HS2 project. And I know this opportunity meant a huge amount to her, and thanks to you, Mr. Speaker, for allowing the House to change the rules. As you said, Cheryl campaigned alongside autistic people and their families for many, many years and successfully introduced the Autism Act in 2009. She was also a champion for people with epilepsy, raising the profile of the condition throughout her parliamentary work. She rejoined the Public Accounts Committee after the 2019 election, and many a permanent secretary feared the force of Cheryl's direct and well-informed questions. But it was working with Cheryl on the 1922 executive, so ably chaired by my friend, the member for Altrincham and Sale, that I observed her real qualities. Her bright mind always enabled her to calmly put things into perspective and provide quiet, sensible and sound advice. She had a real sense of caring for people, particularly when they were in difficult or sad circumstances, and she would always be there, offering them words of comfort. So in saying farewell to Cheryl, her family, her friends, constituents and staff, the whole House has lost one of its hardest working members, who had an enormously generous heart, always prepared to have a kindly word for anyone in trouble, but above all, a fierce and effective defender of her constituents in Chesham and Amersham's interests. Mr. Speaker, people like Cheryl who enter politics for the very best of reasons are rare indeed, and she will be sorely missed. Yeah.
I've now got a point of order virtually from Harriet Harm.
Speaker,
I was so sad to hear of the death of Cheryl Gillan at the age of only 68. I think sometimes politics can feel like a hostile environment. And that's why Cheryl was so important as somebody who was just completely warm, non-judgmental, vivacious and outgoing. She called us all darling, not because she'd forgotten our names, but just because she wanted to put everybody at their ease. When she came into the House in 1992, as one of 336 Conservative MPs, she was one of only 20 women. So she was very much a pioneer of women's presence on the Tory benches. And over the 3 decades that she served in the House, she very proudly and protectively watched over the growing flock of Tory women MPs. I think it was very energising to work with her on her autism campaigns, and it was admirable to see her being such a thorn in the side of the government, fiercely championing her constituents in their opposition to HS2. But above all, I know she'll be missed by her family, to whom I extend my deepest, deepest condolences. We really, really will miss her. I can't hardly believe that she's not standing up there on those green benches today. She was such a presence in the House, becoming a grandee in the 1922 committee, but never grand. I'd like to just briefly mention the loss of Shirley Williams, who was a member of our House from 1964 to 1983. I briefly crossed over with her when I came in 1992. And to my young and pregnant self, despite the acrimony and bitterness between the Labour Party, and I was a Labour MP, and the SDP, which she was a member of, she so warmly welcomed me to the House. She was an extraordinary politician, an extraordinary intellect. She was vilified by the press for her wild hair and overflowing handbag. She too was a woman in a man's world, a champion of social justice and an instinctive feminist. So I extend my sympathy to her family too.
Point of order, Sir Graham Brennan.
Mr. Speaker, thank you for this opportunity to pay tribute to a great friend, Dame Cheryl Gillan, and also to the former members who have passed sadly in recent days. I'm grateful to colleagues on both sides of the House for the warmth of the remarks that have been made about Cheryl, both today and indeed over the days since she died on the 4th of April. Mr. Speaker, you mentioned her kindness to new members. Well, I was a beneficiary of that in 1997, as she, as an education minister in the previous Parliament, came back in that Parliament and was very active in making sure that those of us with an interest and passion for education got involved in dealing with the first piece of legislation in that government. Much has also been made of the great work that she did in promoting the interests of women in the House of Commons. I, though, would also, of course, want to add that I ended up being perhaps the greatest beneficiary of her sterling qualities in the few years that she spent as Vice-Chairman of the 1922 Committee, and I certainly benefited from her great unflappable qualities. She was a very smart, very stylish woman, and always there to give support. And as soon as something happened, and we had 1 or 2 emergencies in the last few years, a call to Cheryl would immediately settle my nerves, and I would know that everything would be done as well as it could possibly be done. Thank you.
Point of order, Sir Olney.
Thank you very much, Mr. Speaker. I feel privileged to say, on behalf of the Liberal Democrats, to be able to extend our most sincere condolences to Dame Cheryl's family and to all her many friends, both across this House and beyond, on the extremely sad news of her death. I feel very privileged to have served with Dame Cheryl on the Public Accounts Committee over this last year, and despite our engagements being mostly remote during this very extraordinary time, I learned a great deal from listening to her as she held civil servants to account. She was always elegant, always gracious, but woe betide any Department for Transport official who arrived unprepared for her dignified and tenacious grillings on the progress of HS2. It's been a pleasure to hear the memories of the member for Cotswold and the member for Peckham on their own experiences and their obviously long association with Dame Cheryl. But I feel the loss quite acutely of what might have been. Despite her long service in this house, she was I was very surprised actually to find that she was only 68, not because she looked older, but because of how long she'd served. And I feel she had a great deal more to give. She's been taken from us far too soon. And for those of us who are much newer to the House, I feel we've lost the great potential there to have benefited from her wisdom, gathered over many, many years. So just like to take this opportunity once more to extend my sincerest condolences. Thank you, Mr. Speaker.
Point of order, Sir Bernard Jenkins.
Thank you, Mr. Speaker. Like my honourable friend for Cotswolds, I was elected in the same year as Cheryl in 1992, so I knew her for over 30 years. As a shadow minister and then minister, like so many women, she was probably underestimated because she did not employ sharp elbows to get in front of her colleagues. Her contributions to PASC and then PACAC when I was chair, she always made very well-informed and principled, shrewd and wise contributions to our inquiries and indeed an advice to me. She knew how to get far more out of witnesses than most people because she was also gentle and polite. She became to me, particularly in later years, one of my most trusted friends. She was an exemplary employer of her staff who were devoted to her. She was terrific fun. And as has been said, she was a champion of women in politics. When she lost her beloved husband, Jack, she raised a fund in his memory for Women to Win, which has helped promote more women into Parliament as a mark of how much he had supported her in her political career. Mr. Speaker, her failing health and then cancer was particularly bitter for her because while the House now allows, outside COVID restrictions, proxy voting for MPs, and she would call them women, I have to tell you, who are expecting a baby or have just had one, we still do not give proxies to people who are incapacitated by sickness. Perhaps we should have a campaign to rectify this and call this campaign Cheryl's Vote. We will sorely miss a trusted colleague and a dear friend.
Thank you.
Thank you, Mr. Speaker, and I associate my comments in full with the honourable member for the Cotswolds, save the bit about the 22 committee, which obviously I haven't had the, dubious in my case, privilege of serving. But Cheryl was, as the honourable member for Richmond has said and others have said, a member of the Public Accounts Committee. I have to confess, Mr. Speaker, I pursued her to join the committee, and she has been fantastic. You would not have known that she was dealing with this serious illness unless you knew. The amount of work she put in would put many other members to shame. Her intellect, her robustness, and her good fun was something I really valued. We did sometimes disagree, but with Cheryl, that was always, we disagreed well. And I think if we can take anything away from the way she's done things here, that hard work, that intellectual curiosity, and that ability to work with people, even though she disagreed with them, in a gracious manner, is something we could all learn from in these times. I will miss her enormously. I can't really believe that she has passed. And it is also quite extraordinary to realise that there are only now 2 Conservative women MPs elected prior to me still serving in this House. So her loss is a loss for women in this place too. I will miss her enormously, and I pass my condolences on to her family, her staff, and her many friends.
To order, Angela Benson.
Thank you, Mr. Speaker. There are very few people in politics who you can consider a real friend. And Cheryl Gillen was exactly that, a real friend to so many people in this place. And in so many ways, she shaped and influenced so many of the things that have taken up a lot of our time in recent years. So she was a huge friend to this House when a number of us cross-party were working on the complaints procedure, Cheryl was absolutely stalwart as a member of the 1922 committee who was determined to get it right, to provide the right level of protection for those who felt they'd been wronged in these Houses of Parliament, and equally to be fair to those who serve here as elected members. She was always absolutely determined to do the right thing, and always in a kind way. She was also a great friend to my constituents of South Northamptonshire, as she so diligently fought on behalf of her own and mine and other constituents against HS2. But we'll leave it there for now, Mr. Speaker. She has been a true friend, but perhaps most of all, she was someone who loved to hug. So, as the mother of the house said, she called everyone darling, but she also hugged frequently, and we don't do enough of that either. And I do completely agree with my honourable friend, the member for Harwich, when he says that she was really, I think, harmed by the fact that she was always so keen to give, and yet this house, when she was very ill, only very latterly enabled her to proxy vote and to take part virtually. We do need to think about that. I agree with my honourable friend, we should call it Cheryl's vote, and I do hope we'll make progress on it. I send my deepest condolences to Cheryl's family and friends. Thank you.
Point of order, Liam Fox.
Cheryl and I entered the House on the same day in 1992, delighted and a little surprised to find ourselves on the government side following that election. With her loss, the Conservative Party has lost a loyal, hard-working and mainstream advocate, the likes of which we see too seldom these days. Parliament has lost a great defender of our values and traditions, someone who worked tirelessly across party lines to make our democracy work better for everyone. And we MPs on both sides of the House have lost an almost unnaturally good-natured, kind and generous friend. Her charm could lure frontbenchers into a very false sense of security, which they seldom fell for twice. And her bravery in the face of a long and difficult illness is truly an inspiration to all of us. If the importance of public service is judged by independence of mind and sound judgment, if the success of public service is measured by the level of respect in which any MP is held by their constituents, and if the value of public service is reflected in the esteem in which any of us are held by our parliamentary peers, then we have truly lost a great public servant with Cheryl's untimely death. She'll be enormously missed and even harder to replace.
Order, Rob Butler.
Thank you, Mr. Speaker. I am a new member of this place, but even in my very short time in politics, Dame Cheryl had a profound impact upon me. I first met her when she came to Aylesbury to help me campaigning from her neighbouring constituency. We had HS2 in common. With her was her much-loved dog, Jimmy, who had brought her so much joy after the loss of her husband. Cheryl walked the street with me. She shared a choice comment or two with a heckler in the post office, and then she sat down in a pub to tell me what was what. And despite having known me barely an hour, she immediately offered me space in her office were I to be elected. She was good to her word, and for my first month here, I camped out alongside her, benefiting not just from a desk and some space, but also from her wisdom. I vividly remember when she'd heard me discussing a proposed email of response to a particularly vitriolic correspondent. She came and stood quietly behind me and said, "I think you can just say, 'I remember meeting you very well.' He will get the message." She was, of course, right. I didn't hear from him again. Dame Cheryl gave me in many of the 29 intake valuable tips that have already stood us in excellent stead. She was always willing to give her time, even that many years after coming to this place herself. She was always willing to share the benefit of her long experience with us. We newbies will miss her too. Dame Cheryl cared. She cared profoundly for her constituents. She cared for fellow members of this House. And she cared greatly for her staff, and they cared greatly for her. It is my honour to have been asked to work with them in the coming weeks. Mr. Speaker, thanks to your kindness, 3 of Dame Cheryl's staff sit today in the public gallery. They are all, of course, desperately sad at the loss of not just their boss, but of a great friend and mentor. They know how much of an impression Dame Cheryl made on everybody with whom she came into contact. And they have expressed to me their gratitude for being able to be here to hear the words of you and of other honourable and right honourable members in tribute to Dame Cheryl's extraordinary service to Chesham and Amersham, to the entire county of Buckinghamshire, to her party and to her country.
We now come to the final point of order from Sir Charles Walker.
Thank you, Mr. Speaker. Dame Cheryl, Mr. Speaker, was a great constituency MP, as we've heard. There have not been many happy days over the past 2 years, but in May 2019, I joined Dame Cheryl and her assistant Mel for a picnic on the banks of the River Chess with our mutual friend Paul Jennings. It was a wonderful day. Her eyes sparkled, the mayflies danced. And I would just say this, she will be much missed by many in her constituency, and the River Chess Association would like, through me, to pass on their great thanks for all her service to it over the past decade.
Can I just say thanks to the House? We're always at our best when we come together, and we certainly, the House, have come together. And just on behalf of myself and the Chair of Ways and Means, she will be missed from the Speaker's panel. Order. I have a short statement to make. I am aware that members are likely to be taking part in campaigning for the forthcoming elections on the 6th of May. It may be therefore a timely reminder to all members and right honourable members, including ministers and shadow ministers, when a member visits another member's constituency, except on purely a private visit, they should take steps in advance to tell the member in whose constituency the visit is taking place. Guidance on this can be found in the document called The Rules of Behaviour and Courtesies in the House of Commons. That guidance also states that failing to do so is regarded by colleagues as very discourteous. Right, let us move on to the next business. I called Annalise Dodds to ask the urgent question.
Thank you, Mr. Speaker. To ask the Chancellor of the Exchequer if he will make a statement on the process by which Greensill Capital was approved as a lender for the Coronavirus Large Business Interruption Loan Scheme.
Minister.
Thank you, Mr. Speaker. Greensill Capital UK Limited were approved by the British Business Bank for the Coronavirus Business Interruption Loan Scheme and the Coronavirus Large Business Interruption Loan Scheme last year in accordance with its published guidance on accreditation. All decisions taken by the bank were made independently and in accordance with the bank's usual procedure. The criteria by which the decisions were made were based on those used in the existing Enterprise Finance Guarantee Scheme, dating back from 2009, and were set out in the CL Bill's Request for Proposals, which was a publicly available document. These criteria included minimum requirements such as the ability to demonstrate a track record for lending to larger enterprises, provision of evidence-based forecasts, the ability to demonstrate that it has sufficient capital available to meet their lending forecasts, a viable business model, robust operations and systems, that the proposed lending will not have unreasonable lender-levied fees and interest, and that the lender has all the necessary regulations, licences, authorisations and permissions to operate the scheme. All accredited lenders are subject to regular audit by the bank to ensure their compliance with scheme rules. Following an analysis of loan data as part of its standard diligence, the bank opened an investigation into Greensill Capital's compliance with the terms of the scheme in October 2020 and informed the government of this on 9th of October. That investigation is continuing, and the government's obligations as guarantor under the CL Bill's guarantee are suspended on a precautionary basis. It wouldn't be appropriate to comment further on the investigation at this time.
Shadow Chancellor Annalise Dodds.
Thank you, Mr. Speaker. Can I start, please, by paying tribute to the Duke of Edinburgh, who was an extraordinary public servant. My thoughts today are with the Queen and the rest of the royal family as we all mourn his passing, and they're also with the friends and family of Cheryl Gillen, and I would just like to associate myself with the very moving tributes that we quite rightly heard a few moments ago. I welcome the Minister's presence, but it was the Chancellor who needed to come to the House today. The Chancellor who told David Cameron he would push his team to amend emergency loan schemes to suit Cameron's new employer. The Chancellor whose officials met with Greensill 10 times. The Chancellor who took the credit for government business loan schemes when they were in the headlines, indeed, who personally announced those schemes. Yet the Chancellor is frit of putting his name to those loan schemes today. He's just spent £600,000 on communications. You'd think that would extend to communicating with Parliament. In the Chancellor's absence, let me ask, what was the alternative that the Chancellor pushed his team to explore after David Cameron texted him? What discussions did government have with the British Business Bank about Greensill's access to CL bills after it had already been rejected for the CCFF? Were the criteria for CL bills amended so Greensill could access the scheme? And why was Greensill the only supply chain finance firm accredited to CL bills? And what due diligence was done? Hundreds of millions of pounds of public money were put at risk by giving Greensill access to this scheme. With Greensill's collapse, thousands of jobs in Rotherham, Hartlepool, right across the country have been put at risk. Those workers and taxpayers across the country deserve answers. The Chancellor said he would level with the public. Why is he running scared of levelling with them on the Greensill scandal? Thank you.
Thank you, Mr. Speaker, and I would like to associate my words, myself with the words about the Duke of Edinburgh and, of course, our colleague Cheryl Gillen as well, whom will be sorely missed. Yeah. The Chancellor wrote to the honourable member last week with a comprehensive response to her questions regarding engagement between Greensill and HM Treasury, and the Prime Minister has asked Mr. Boardman, Nigel Boardman, to conduct a review that will look into the decisions taken around the development and use of supply chain finance and associated scheme in government, especially the role of Lex Greensill and Greensill Capital, and set out any findings as necessary. And the government will recognises the interest in the matter, and it's right that we now let that investigation, that review happen and do its work. But in line with the approach and the interest of transparency, so the Chancellor has provided all of the message, and that was sent from him to David Cameron on this matter, and they relate exclusively to Greensill's proposals for the COVID corporate finance facility. And what was important about that, the Chancellor is right to push officials, as we all have, to make sure that capital, that we can explore all ways of capital getting to businesses large and small, as all members of this House were asking government and demanding government do at that particular point. But with regard to CCFF, it's absolutely important to remember that the Chancellor rejected the idea that he should rewrite the scheme to include any banks within that scheme. But the reason that the Chancellor isn't here, because of the question that we've been asked, we've been talked about CL bills, and I would suggest to the honourable lady that she may ask in a different forum or ask a different question, because the coronavirus large business interruptions loan scheme to which the question pertains is administered by the British Business Bank. The Secretary of State for Bays is the sole shareholder in the bank, and as such responsible for the delivery of the scheme sits with Bays. But the accreditation process for any of the COVID loan schemes is run independently by the British Business Bank. Neither Bays nor HM Treasury had a role, or were involved in the CL Bills accreditation decision by for Greensill. There were two other non-bank lenders accredited under CL Bills, with over 75 accredited for C-Bills. It's an important feature of the COVID loan schemes that there were a diversity of lenders that ensured that broad range of choice for borrowers, enable them to access the finance they actually needed to survive and recover from the pandemic. Greensill wasn't accredited to provide supply chain finance through the CL Bill scheme. It was only accredited to provide invoice finance, term loans and revolving credit facilities.
Listed back.
Thank you, Mr. Speaker. Will my honourable friend confirm that in all dealings with Greensill, the Business Department, the Chancellor, his ministers and his officials always followed all appropriate codes of conduct?
I don't mind friend for that. And indeed, all of the questions were, all of the decisions were taken independently. And that included rejecting Greensill from being able to access the higher level of loan facility. The only request of which came from the shadow front bench, the shadow secretary for Defence.
Let's go to SNP spokesperson Alison Thewlis. Alison.
Thank you, Mr. Speaker. Can I first express my condolences on behalf of the SNP to the family and friends of Cheryl Gillen and Shirley Williams. And I'd also like to wish my constituents and everyone celebrating Ramadan Mubarak and a happy and peaceful Vaishakhi. This scandal is which further exposes the depth of cronyism at the heart of this UK Tory government. And it's not new, because back in November, the National Audit Office raised concerns about a VIP list of suppliers, with those on the list 10 times more likely to get a contract than those who earned. And the Financial Times reporting today that £19 billion of COVID contracts were awarded without rival bids. Mr. Speaker, there remain serious questions on the roles of Greensill while Mr. Cameron was Prime Minister, and on who exactly is being afforded similar influence in the UK government today. It is absolutely galling that while some have hoovered up so much government support, when millions who don't happen to have the Prime Minister's phone number, who don't happen to have ministerial phone numbers, get absolutely nothing at all. So will the Prime Minister, the Chancellor and the Health Secretary come before this House to explain their actions? And how can we have confidence in this inquiry that's been announced? From the Home Secretary's bullying to the race equality report, this UK government has such a woeful record in marking their own homework.
Minister.
Thank you, Mr. Speaker. A number of those issues were slightly wider of the mark of this particular question, but indeed the review will do its work, and Nigel Boardman has had the assurance of all the parties that they will cooperate and offer any information required, and he's due to report back at the end of June.
Jacobian.
Thank you, Mr. Speaker. The furlough scheme, the self-employed income support scheme, and the coronavirus business interruption loan scheme have been lifelines for many thousands of my constituents in Redcar and Cleveland. And across Teesside, almost 500 businesses have benefited from CBILS worth well over £100 million. Can the Minister confirm that all of these businesses have gone through the appropriate checks to be approved, and that HMRC will take action against any fraudulent abuse of the scheme?
I thank my honourable friend, and he's absolutely right. Any business applying for any of the government schemes, as I've talked about, the accreditation to deliver those schemes has to go through a robust procedure. And indeed, HMRC and other organisations will make sure that we are hot on board, because this is taxpayers' money that we're talking about. And that's why, in the instance of the question, the Chancellor, it's important to remember that the Chancellor rejected the suggestion that was put forward. So the process is doing its job.
Thank you very much, Mr. Speaker. When a former question of the similar nature came before the House just before recess, I asked the Secretary of State for Bays whether a list of all of those organisations that had received loans, whether under Bounce Back or CBILS or any of the other schemes, would be made available, because previously the Minister has said that that will be done in due course. And on that particular occasion, when I asked the Secretary of State, he said to me he will try to see what can be done to put that list of businesses in the public domain. Now, I hope the Minister agrees with me that many of these questions are arising because of the lack of transparency in the way that some of this support has been awarded. So I would be very keen if the Minister could tell me, how is the Secretary of State getting on with publishing that list?
As the Honourable Lady will know, that at the time of delivery, we were trying to deliver money to these businesses as quickly as possible. But the fact that they have accessed, especially the CL bills and the larger loans, will appear in those businesses' accounts, and obviously they will be reported to the European Union should they be required for state aid purposes.
Let's go to Nigel Mills. Nigel.
Thank you, Mr. Speaker. Can I remind the Minister that one of David Cameron's last big acts as Prime Minister was to hold a large anti-corruption summit in London with some hard-hitting findings. Will the government recommit to delivering on all the promises made in the following anti-corruption strategy? Will you confirm that if any changes need to be made as a result of the inquiry that's just starting, they'll be brought to Parliament as soon as they possibly can?
I thank my honourable friends, and I admire his work on anti-corruption, and it's important to keep raising this issue as well, but it's important as well to keep the sense of perspective that we tackle actual anti-corruption rather than speculating on other issues for political purposes. As I say, it's important to remember within this circumstance here that the process has worked well, in so much that it was right to push for as much capital to flow with small and large businesses, but it's important to remember that the Chancellor did reject the suggestion put forward by Greensill.
Let's go to Navendra Mishra. Navendra.
Thank you, Mr. Speaker. I'd like to wish all celebrating the Hindu New Year a happy Navratri and Sikh community a happy Vaisakhi today. Mr. Speaker, the Bank of England is rightly independent of the government. Can the Minister confirm whether or not Bank of England officials were requested by the Treasury to make amendments to its COVID corporate financing facility to suit Greensill Capital after the former Prime Minister had texted the Chancellor?
Honourable gentleman, as I said, the Chancellor rejected any notion that the CCFF scheme should be rewritten.
Thank you, Mr. Speaker. And if we can put to one side the blatant political opportunism here, there is a scandal behind this. Greensill failed because it overextended itself to GFG Alliance. That was signed off by Grant Thornton, GFG's auditors, effectively signed off on a business model that included borrowing hundreds of millions of pounds based upon the security of a very insecure, possibly non-existent order book. Will my honourable friend therefore bring forward his intended reforms for the audit regulatory system and make sure that Grant Thornton's role in this is properly investigated?
Very good. I thank my honourable friend for that question, and he will, I'm sure, I know, appreciate the audit reforms that we're currently consulting on. It's absolutely right that the markets work when they are transparent, when they're open, and that's why we're determined to make sure that in the light of recent failures, that we actually get these audit reforms through, and I look forward to his contribution in that debate.
Thank you, Mr. Speaker. Mr. Speaker, it is incredibly sad and disappointing that throughout this pandemic we've seen too little transparency from government about every aspect of how taxpayers' money is being spent. And the government keeps coming to the House and saying, well, it was terribly difficult in those first 2 weeks, 2 months. We are now a year on and we're still uncovering more. Will the Minister tell the House whether he's really satisfied that a 6-week inquiry dragged out as an announcement by the Prime Minister yesterday is enough to shine sunlight on the millions of taxpayers' money that has been given to organisations like Greensill, backed by government, and therefore a loss to the taxpayer when things go wrong? Is 6 weeks enough? And will he now commit to far more transparency, including, if necessary, calling witnesses before this House?
I think the honourable lady talks about two different things, because there is a review into supply chain finance and its work with the request from Greensill Capital. But clearly, the wider view of taxpayers' money and how it was spent when the government was working about as close to real time as it will ever get to do. For business owners will understand the huge difference between the speed that business works and government works. But we will make sure that taxpayers' money has been spent, so we will review it, but also make sure that we chase people, as my honourable friend, the member for Redcar, says, who have used government grants and support inappropriately.
Let's go to John Howell. John.
Thank you, Mr. Speaker. Isn't it true that the accreditation process that was used allowed a wide diversity of lenders to become accredited under the scheme in order to give more choice to borrowers? And it was this focus on what was the choices available to borrowers that was crucially important.
I thank my honourable friend, and he's absolutely right. This is why the Chancellor, this is why a number of ministers, as I say, reflected the view of this House that we wanted to push to make sure that we had that diversity of finance, of capital available to businesses of all different types. And that's why we should be proud of the support that has been given out, that's allowed companies to be able to get through this incredibly difficult time, as it remains a difficult time.
Let's go to Chris Stevens. Chris.
Thank you, Mr. Speaker. In responding to this story, David Cameron wrote,
that important lessons must be learned? I should certainly think so, given these shady backdoor lobbying efforts with cabinet ministers. So the question is simple. If current serving ministers are found to have breached or have been in breach of the ministerial code, will they resign?
The point that I can answer is that this review will look to see exactly what happened in this situation, and Nigel Boardman will do his work, which will be reporting back at the end of June. And all of the parties involved in this have actually committed to be able to make sure that all of the information is available.
Let's go to Bob Blackman. Bob.
Thank you very much, Mr. Speaker. And clearly at the beginning of the pandemic, when it first struck, it was vitally important that we moved as a government very swiftly to ensure the protection of SMEs. So does my honourable friend agree with me that it was right that the Treasury listened to and gave consideration to all the potential options to support business to survive the pandemic, given the extraordinary and unprecedented challenges facing UK SMEs last spring?
My honourable friend is absolutely right, because the scheme that we were asked about today, that large businesses, protects a large number of jobs within those big companies within that. But it's also right that we looked at a diversity of lenders, a diversity of approach to cover small businesses as well, who don't always have the resilience, the capacity as those larger businesses do to be able to survive and respond in these tough times.
Let's go to Steve McCabe. Steve.
I assumed whatever it takes, Mr. Speaker, meant making sure people got the help and support needed, not deploying Treasury officials to try and mangle the rules in order to protect David Cameron's shares. Just how many people and how many hours did the Chancellor devote to Mr. Cameron's concerns, as opposed to those 3 million excluded self-employed people this government has abandoned?
The Chancellor and other government ministers have spent many, many hours speaking to lenders, speaking to businesses of all sizes to make sure that we can best reflect and flex on the support that's given to them. The system worked when he was asked to change the scheme inappropriately, and because it was a government-backed scheme with the Bank of England rather than allowing banks to be involved in the CCFF, and that's why he rejected that, which meant the procedure went well.
Mike Wood. Let's go to Mike.
Thank you, Mr. Speaker. Businesses in Dudley South want support to get to those businesses that need them as quickly and effectively as possible, rather than just falling back on how things have always been done when the times are far from ordinary. Can my honourable friend assure them that while processes will be transparent and due diligence will be done with taxpayers' money, that his department will continue to look at all options to make sure that that necessary support is getting to where it's needed, rather than just going with traditional processes of distributing funds?
Minister.
And he's absolutely right. What the Chancellor, what the my Secretary of State for Bays and other ministers have done throughout all of this is to make sure that we can flex, that we can respond rather than react to events as best we can, by speaking to businesses, large and small, by speaking to the stakeholders to look at the cliff edges of support and try and smooth those out as we get to that roadmap, as we start to reopen and recover our economy. Now is just as important as ever to make sure that we have that flexibility within our support.
Let's head to Margaret Farrell. Margaret.
Thank you, Mr. Speaker. It's apparent in the text messages sent in April 2020 between the Chancellor and David Cameron, now published by the Treasury, that the Chancellor pushed the team to explore an alternative with the bank regarding cheap loans for Greensill. Could the Minister explain what these alternative arrangements were and why Greensill was deemed such an important recipient of public funds, even after the Bank of England refused to authorise Greensill's entry into the COVID corporate financing facility scheme?
The Bank of England refused Greensil's entry because there were no banks in that. It was a way of government and the Bank of England getting money to businesses and underwriting it rather than being a separate loan scheme. That's why Greensil were accredited for CL bills. The only other request to expand Greensil's reach was actually from the member of the shadow front bench, who asked for them to receive the higher level, up to £200 million.
Let's go to Andrew Gwynn. Andrew.
Thank you. The Chancellor now washes his hands of the COVID public lending schemes that he set up. It's laughable given the fanfare and fuss he made of their launch. I almost feel sorry for the Minister. He's been sent here to defend the actions of senior ministers, not even in his department. But given the Chancellor is the person who we know received lobbying texts from David Cameron, can the Minister tell the House what he thinks the Chancellor is afraid of?
The Chancellor has delivered 365, I think it is, or £56 billion worth of support currently to businesses. He has flexed at every opportunity with across government devising and designing loan schemes, which are overseen by the British Business Bank, which is overseen as the single shareholder by the Secretary of State for Bays. And so that's what we should be proud of. The Chancellor is not afraid of anything here. We are talking, the question here is talking about the Corona Large Business Loan Scheme, which is administered by Bays, and that's why I'm here to answer that question.
Let's go to Stella Creasy. Stella.
Thank you, Mr. Speaker. I understand and share my colleagues' concerns about lobbying, but like other corporate financial scandals such as Enron, we need to follow the money. We know that it was the German Greensil's bank that made the loans to Sanjeev Gupta, that also supported their use of the private jets, which we know our former Prime Minister made many journeys on, and we know is now under criminal investigation as many thousands of German people face bankruptcy. So can the Minister tell us what conversations he's had with the German prosecutors about the CBILS loan schemes, and if they will be invited to give evidence to this inquiry?
I thank the Honourable Lady for that. And as I said in my opening statement, the bank has opened an investigation into Greensill Capital's compliance with the terms of the scheme in October 2020 and informed the government of that in 9th of October. And that is continuing, and the obligations as guarantor under the CL bill scheme are suspended on a precautionary basis, but it wouldn't be appropriate for me to comment on further investigation at this time as it's ongoing.
Thank you very much, Mr. Speaker. As if the billions of pounds of crony COVID contracts wasn't bad enough for hard-working Brits to stomach, we now have a former Tory Prime Minister sending private text messages to the Chancellor and other Treasury Ministers, lobbying for government loans for a firm in which he himself is a shareholder, and that is now insolvent. We have him going for a private drink with his financier friend Lex Greensill and the Health Secretary, and we have a Chancellor who messaged back to say that he would push his team to find a solution, and now he has neither the courtesy nor the courage to come to this House to be held accountable for his actions. So does the Minister agree that this just stinks, downright stinks, but not just because we are dealing with talking about former and current Tory ministers all in it together, but because this isn't just the Chancellor's money that has been put at risk, it is the British taxpayers' hard-earned money that is at stake.
May I just respectfully ask the Honourable Gentleman through the Speaker that if he wants the Chancellor to come and ask a question, he might ask a question that relates to the Treasury, rather than one that comes under the British one that comes under the British Business Bank, which is the responsibility of Bays. As for the Chancellor, as I say, the system has worked. He may be touting and touting his opposition day debate tomorrow about wider things, but the Chancellor asked his officials to push for wider capital flows to be able to go through larger and smaller businesses, as we all wanted. And he rejected Greensill's requirements or asked to try and change the CCFF scheme to involve banks, including Greensill, which process worked.
Ben Lake.
Speaker. From a former Prime Minister texting ministers in pursuit of his own financial interest to concerns of Russian state access to the other place, it is little wonder
that questions have arisen as to the integrity of decision-making in the UK. Now, while I acknowledge the government's commitment to investigate the Greensill debacle, will it go further by implementing the Intelligence and Security Committee's recommendations regarding undue influence in decision-making, and in particular end the practice of loads for boards, to safeguard the transparency of our democratic decision-making?
Thank the honourable gentleman for that. This review specifically looks at supply chain finance and the discussions with Greensill. And as I say, Nigel Boardman will do his work and report back at the end of June.
I'll be back.
Thank you, Mr. Speaker. I've written to ministers on behalf of businesses in Chesterfield, as many other ministers, many other MPs have done, and waited months for a reply when a business was on the brink. Yet Greensill get 10 meetings in 3 months with Treasury officials, and the junior minister has the audacity to stand there and say this is a system that is working well. When David Cameron was the Prime Minister, he said of corporate lobbying, it's money buying power, power fishing for money, and a cosy club at the top making decisions in their own interests. He couldn't describe this grubby, shabby government any better, could he?
Treasury ministers, as have other ministers, have had a number of meetings with lenders of all sorts, and that's why, as we've heard earlier, it's so important to have the diversity of lenders involved in that, and that becomes from understanding their model, understanding what support they can give, but that accreditation itself was determined independently by the British Business Bank.
Alan Brown.
Thank you, Mr. Speaker. The inquiry announced by the Prime Minister seems to focus on the actions of David Cameron, but it's quite clear what's bigger consideration is the actions of the government ministers and how they interacted to get Greensill what they wanted. And Mr. Speaker, this goes along with government business as usual, which is crony appointments to the House of Lords, crony appointments to external bodies and regulators, Tory peer Baroness Harding appointed for the rollout of the failed track and trace system, and then all the dodgy PP contract awards. Surely it's not just a short inquiry that's needed, it's a public inquiry into the entire actions and dealings of this government.
The review goes beyond the actions of one man within this, but it's important to remember that the Chancellor in particular rejected to get what Greensill actually wanted. So there is no case in that regard, because that was rejected out of hand.
Let's go to Farrell Clark. Farrell Clark.
Thank you, Mr. Speaker. Mr. Speaker, the public deserve answers. This is not Prime Minister's money or the Chancellor's money or the Conservative Party's money. It is public money. So can the Minister explain why Greensill Capital met Treasury officials 10 times, as my colleague said, in the course of last summer, when most meetings any other CBILS lender secured with the Treasury was 2, and vast majority of lenders did not even have any meetings with his department.
Lenders and businesses have had many meetings across government, and there's without favour. And this is important to make sure that we can get that information, to ensure that there was a diversity of lenders, to ensure that we could flex, which is why the various loan schemes were added to and amended along the way to make sure that we could take the temperature of exactly how that lending was working or wasn't working.
John Cryer.
Thank you, Mr. Speaker. I'd like to associate myself, first of all, with the comments made about Cheryl Gillan on all sides of the House earlier on. Now, many members will remember that 7 years ago, when David Cameron was putting through his lobbying bill through this place, he point-blank refused to adopt any clauses or amendments which would bring greater transparency to the corporate lobbying industry. I wonder why he did that. Now, all these years later, isn't it time to put that right? Introduce greater transparency, not to stop corporate lobbying. It's a perfectly legitimate business to engage in, not to stop it, but to introduce greater accountability so we know and the public knows who's being lobbied and by whom.
Well, I started off talking about the fact that the market works when there is transparency, where there is openness, and lobbying is exactly comes in within that. So we should always review what isn't there, and the lobbying register that there should be working. We need to make sure that continues to work. But we always should be able to review lobbying activities to make sure that it is, as he says, transparent.
John Trick.
Thank you, Mr. Speaker. Isn't the central fact
that there was communication by a former Prime Minister with ministers about his private interests? And will he confirm that this is a breach of the long-standing British value that high office is not a grubby route through to great riches in the afterlife? And will he indicate that he could take immediate action while we wait for this inquiry, which sounds like a whitewash to me, that there are things he could immediately do to remove this impression that public wealth, powerful wealth, dominates public institutions? He could stop the revolving door between ministers and the private sector. He could stop immediately all forms of lobbying within Westminster and Whitehall. And finally, he could stop the process of outsourcing to Tory chums.
What I can do is to explain the difference between an output and an outcome. An output means you can have any number of meetings, any number of requests. Unless you block the number, then any minister will receive those texts. An outcome is what actually happens as a result. And I was absolutely clear that the Chancellor rejected what was put forward by Greensill and rejected what was put forward by David Cameron.
Thompson. Mr. Speaker, this process is just another example of COVID contracts which are now becoming a genuine source of public concern and allegations of further undermining public confidence and cultivating a feeling of suspicion amongst the public in the activities of this government as a whole. How does the government propose to rebuild public trust in the wake of yet another scandal coming forward?
Having been in opposition at a local level, I know where the speculation, the mistrust come from the public, and it is that chipping away, politicisation of some of these issues. But the Chancellor has been particularly robust in the actions and his outcomes there. There is a review here that will report, as I say, Nigel Boardman will do his work. People have committed to be open and transparent in their work with Nigel Boardman, which will report back at the end of June, and that will show the results that the public will be able to see.
Yeah. Let's go to Dame Angela Riedel. Dame Angela.
Thank you very much, Mr. Speaker. Can the Minister tell us whether the British Business Bank was approached by senior civil servants or ministers about Greensill having access to the coronavirus large business interruption loan scheme? And did Greensill exceed its authority and lend more than it was authorised to lend? £400 million to the Gupta Group alone, all of which has now been lost.
I'm not aware of any communication between ministers and British Business Bank about the accreditation of Greensill, which was made independently of government. And as I say, there is an ongoing investigation into Greensill, which I would be inappropriate for me to comment at this time.
Emma Lewell-Bell.
Thank you very much, Mr. Speaker. 5 years ago this week, the former member for Bolsover was asked to leave the chamber for using unparliamentary language towards David Cameron regarding his personal finances. Does the Minister now agree that Dave was, and indeed remains, dodgy?
No.
Let's go to Rachel Muskell. Rachel.
Thank you, Mr. Speaker. When businesses continue to collapse and charities fold in our constituencies because they haven't received a penny of support, it now appears that not everything the former Prime Minister did was for the record, as exchanges took place to procure hundreds of millions of pounds out of the Treasury for a company he was profiting from. The very loopholes that Labour tried to close in his lobbying legislation left sufficient room for this corruption. So will the Minister stop hiding the detail and now publish a timeline of every meeting, call, text message and conversation between the former Prime Minister and members of this current Conservative government and their officials, publish them before this House so we can understand the extent of his lobbying?
Well, the Chancellor has published his text messages, and there is a review that, rather than hiding, is actually going to go into the detail. And as I say, all of the parties involved have pledged their commitment to comply with this investigation, which will report back at the end of June.
West Street.
Thank you, Mr. Speaker. The simple fact is, again and again and again, members on all sides of the House pleaded with the Chancellor to meet with us to hear the plight of millions of people who were excluded from any government support. And the Chancellor would never find the time for such a meeting. But a few texts from Dodgy Dave and Greenseal's got 10 meetings and a ream of correspondence with senior Treasury officials, the type of access that most businesses in this country could only dream of. So can I ask the Minister why it was, in correspondence between Greenseal and a senior Treasury official, they put in words, and I quote here, whilst not using this precise phrasing, we have crafted a formulation both in substance and form which provides an even stronger political position. Why is a private company advising Treasury officials about political positioning? And doesn't this show, despite his protestations, why it's ludicrous that the business minister is here and not the Chancellor? And if the Chancellor had nothing to fear, he'd have nothing to hide and would be here to answer the questions.
I'm afraid in government we have to deal with details, and details is sort of asking the right question. Details is asking the right question in the first place. If you ask a question about a Bay's responsibility, I think it's fair and reasonable that a Bay's minister should come here. And but I come back to the point. That the honourable gentleman can come up with all he likes about process. What businesses want are outcomes, and outcomes that means business capital flowing through these businesses. And the outcome in this situation was that the Chancellor rejected such a proposal. But the detail that he's talking about will be investigated by Nigel Boardman, and that review will be published by the end of June 2020.
Stephen Flynn, final question.
Thank you, Mr. Speaker. Just 3 weeks ago, I asked ministers to back an independent investigation into the actions of Crony Cameron. At that time, they refused to answer, so I welcome the U-turn again that's taken place. However, what the public expect and what the public want is total accountability and transparency. So will the Minister back a wider review into the dishing out of COVID contracts to Tory donors and friends?
I'm not sure I recognise the names that he'll call the former Prime Minister, which I think is inappropriate. There is a review that is available, that is being investigated as we speak, and with regard to COVID, as I say, there are a number of things that we will look at back when we are past this pandemic, when we'll look back at what has happened and the support that this government has given, the many hundreds of millions of pounds that this government has given to small and large businesses.
I'm suspending the House for 3 minutes to enable the necessary arrangements for the next business. Order.